It is public knowledge and common knowledge that electricity or power supply is a major challenge at the University College Hospital, Ibadan, in view of our recent experience. And in fact, the lack of electricity or adequate supply of it has been a suffocating and strangulating albatross around our necks. And what Mr. President has done is to unleash a relief on us in this particular agonizing situation that we found ourselves. We know that the public supply or the municipal supply, the national grid, has not done us much good in terms of erratic supply, in terms of the tariffs that keeps changing and mounting in spite of inadequate supply. So having the promise of Mr. President that the University College Hospital will be involved in the next dispensation of solar and inverter, installation of solar and inverter system to the hospital is a major relief for us, and we are so glad and grateful to Mr. President. And this is going to be something that will bring or remove our distress, to remove the distress of our patients in accessing our services. You know, over 80% of our medical equipment and appliances rely on regular electricity. And when this is absent, both the healthcare giver and the healthcare receiver are the receiving end in terms of waiting time for patients, because you cannot continue with certain procedures, and also the cost of alternative energy supply in terms of diesel. Every month we get a bill of about 100 million from municipal electricity supply, and we still spend about 12 to 20 million naira on a monthly basis, and yet this is still not adequate. And I will also say that because of this, the work environment is becoming a bit toxic for some healthcare workers, and it's part of what is causing the jackpot syndrome, apart from the remuneration that is inadequate at this point in time. So we believe that when this is implemented and we have regular electricity supply, there's going to be a doubling in our efficiency, in our effectiveness, and in our service and care and patient outcomes. There will be efficient and equitable health system in our hospitals. I know it is not only UCH that has this problem. So I believe that this is a major leap in the right direction, and I believe Mr. President will walk the talk as he has always been doing. Therefore, we believe that in the no distant future, we'll have this installed in our hospital, and this will improve our efficiency in terms of clinical service delivery. This is also a huge relief for us. On our own as management, we've been trying to do what we call PPP to get some of this equipment. Some of them have materialized, some of them are still ongoing. But with what has been approved for us as a hospital, this is also a major relief. And in fact, I will call it a breakthrough for many of our patients. As it is now, we are limited in our capacity to treat some patients. So this will boost our treatment capacity. I've seen some of our patients who break down in tears when you ask them that, oh, you don't have this equipment, therefore you have to go to so place. They have the money to pay. Even some of them have the money. Let's not talk about indigent patients. They have the money, but the trouble of having to be moving frail patients up and down, going to unknown environment, is a major issue, which I believe what our president has approved for us will solve. Like I said, it will increase our treatment capacity. Like I was in Maiduguri last week at the meeting of committee of CMDs, and one of our colleagues, Professor Ahijo, told us that the LINAC machine, which is the latest treatment for cancer they have, will treat 100 patients in one day. I said, wow, because in a matter of seconds, it has done the job, you move in the next patient. So we are looking forward to that kind of experience at the University College Hospital, Ibadan here. So our patients will have the best of care. Our clinicians will also have the best. We will be able to offer their best to the patient. The work environment will bring job satisfaction, and many clinicians or health workers would like to stay back in this country and give in their best to the system that they so much love.